about us.
Hello. What's going on? I see Roel is in the building. Let's see here. I'm just making sure we are live everywhere. All right. We're on Instagram. Okay. D-Lynn, what's up? Mama B's Place, what's up? Can everybody hear me okay? We got a good show in line for you today. We're going to be here till about 8. Answer as many questions as we can. Want to thank everybody who sent in questions throughout the week. My brother Tom, what's up? Yeah, for sure. For sure. Loretta, what's up? Jerry, hello. Okay, thank you, D-Lynn. Thank you, thank you. We're going to let a few more people come in. Let's see here. I do think we are live everywhere. Okay. Evangeline, what's up? Hope everybody's doing well tonight. This is the Performance Medicine Show where we answer your health and wellness questions. Let's see. It's interesting. Oh, thank you. Thank you. All right. Doc is getting ready. If you're new, let me know. If you're here, let me know. Katie, what's up? Great to see you. Edna, hello. Thank you, D-Lan. Hit that like button on YouTube. Pen 1010. Pen 1010, where are you from? I'm thinking somewhere in Tennessee. Is Doc ready to roll? Not yet. Don, hello. On Facebook. Real quick, guys. Real quick, if you guys are not signed up for Performance Weekly, please do. That is the best way to stay in touch with everything that we're up to. You can find that on performancemedicine.net. If you were on that email, we sent it out on Tuesdays at 3. You would know that this went out this morning. That right there is Jill Henritzi, our PA over in our Bristol office, who is an orthopedic expert, has 18 years, I believe, experience in orthopedics. Her and Dr. Rogers talk about cortisone injections. When is the right time? What's it for? When not to use one? I think there's a lot of misinformation around cortisone shots. So really interesting episode. Huge shout out to Jill in the Bristol office. Thank you guys for doing that. And then let's see here where I'm at. We put this in the weekly as well. This is a throwback episode of Explain This with the star of the show, Robin Riddle, low testosterone in women. As many of you here know, live with us, women need testosterone too. Robin talks us through that, how we look at replacing testosterone in women. Thank you, Robin, for doing that episode. All right, Pen 1010 and Kingsport. Sweet. Rachel, it's so good to hang out with you last week. Had so much fun. Yes, Katie, we had an amazing week last week transitioning into EMR and just super proud of the entire team. All 6 offices and this week has just been amazing transitioning into EMR. Thank you, Katie, for putting that in there. Staff has done just absolutely amazing. Ivy and JC and I with Ivy, great to hang out with you last week. Thank you for being here. Doc, ready to roll? All right, let's rock and roll. What's up?
Hello, Ben. How are you?
I am wonderful. Real quick, Doc, we got Foxy Moxie in here. We've got Edna with a great question. Jack's in the building. Thank you, Jack. How's the day? You look a little red. Is your red light on?
It's the lighting in here. My red light's not on, but no, I haven't been taking melanotan or anything. This is just the lighting in this room. I can't get it right. But anyway,
there we go.
Here.
Are you ready to? Was your day okay?
My day was good. We're getting used to the EMR. I don't like EMR, but we have to do it. So some things in life you have to do. Couple things. One, I just found, we changed locations, and this picture I just found in my book of me on my first day as a doctor. Look at that.
No kidding.
Yeah.
That is awesome.
Um, Back then, we carried around a black bag, and I guess that was 40 years ago or more. So I had a black bag, and I had the white coat, the long white coat. But that was me.
That's cool.
Um, what you said that Robbins explained this was about low T in women. It's funny because the last patient I saw today was a woman that had low T, and that's really, she was already on a estrogen patch and progesterone from somewhere else. But in any event, she came back in today and she told me that I was responsible for her getting a new job. I didn't know what she
No
was
kidding.
talking about. Actually, she took a job in Oak Ridge,
Oh, nice.
and a high level job. And she said that it was because I put her on tea cream because it helped her memory and her energy. She attributed that entirely to her changed outlook. So it was a great bit of feedback for testosterone in women. It's funny because, as you'll see in Robin's presentation, most doctors don't know women need testosterone,
Yep.
as much as men do, just a lot less, but it really changes everything in a woman. Um, that is the one hormone that's going to make the most difference in how you feel. So there's women out there that haven't had their T levels checked. You better get it checked because if you're low, you're shortchanging yourself. And it doesn't cause blood clots. It doesn't cause cancer. It helps prevent those things. So a lot of misunderstanding about testosterone in women. A lot of misunderstanding about testosterone in men as well. But anyway, so just a good note. So listen to Robin's episode.
That's so
Okay.
cool. That's a great story, and it's it's funny just how a little something like that can impact your entire life. That's so cool. I see you, Lisa, Shelly. See you guys. Thank you, Rachel. Wesley's in the building with Robbie. Love you guys. Love the Jacksons. Jackson 3. Okay, let's get to some questions here. If you got a question for Doc, go ahead and put it in the comments. We're going to be here till around 8. Let's start with this one real quick. Can Dr. Rogers recommend a foot doctor? And also, what is the name of the red lights he uses? We'll start with the foot doctor. I'm assuming Tri-Cities or Knoxville. Any foot doctors you recommend?
Yeah, the Tri-Cities, I like Dr. Shadowski. I use him a lot. He's worked on your toes
Yeah.
a few times. Back when you're on the tennis circuit, you got a lot of ingrown toenails, and he had to remove several of them painlessly. He's just really good. So I really like him. He's a good person. And there's a Dr. Ingbloom, I believe, in Knoxville that's really good. Our own Brittany Miller, our
Yep.
PA in our Johnson City Clinic, worked in Knoxville for 8 years as a PA in podiatry. So whenever I get a foot question, I just send them to Brittany. She usually take care of it. So there's a lot of good ones around, podiatrist. There's a couple really good foot and ankle surgeons, orthopedic surgeons, if you need surgery on your feet. Dr. Parker Duncan is very good, who I played pickleball with a couple times recently. And there's a Dr. Fogelman in Bristol. He's really good. So there's a lot of good people. And your feet really can determine how miserable you are. If they're bad, you're gonna be miserable. So the name of the red lights is Lumara. That's my favorite. That's the ones I use. Lumara.
And
Lumara, I believe.
Lumara, that is right. And thank you, Ivy, for this. I'll put Ivy's comment up here. Sally Randolph. If anybody has a foot doctor that they love or have been to, put them in the comments. Let people know. I love doing that. I see Edna saying she is awesome. Thank you, Edna. So a lot of good feedback from Sally. Diane, I
Ooh,
see you.
I
Thank you,
know her.
Diane. I see you. Dave, what's going on, man? So many cool, man, all of our friends. Victoria's in the buildings. Huge shout out to Victoria. Thank you for being here. Okay, let's keep moving. If y'all got a question for Doc, put in the comments. We're going to get to them. All right, this question came in through email. My husband has an aneurysm on his aorta in his abdomen. His PCP wants him on a statin because his cholesterol is a little high. I asked his vascular what he thought about it. He said he likes statins because they strengthen the artery walls, and that is good if aneurysms are present. He suggested Crestor 5 milligrams. What does Dr. Rogers think? And if you need any context, let me know.
Yeah, I agree. I agree. There's a lot of evidence that with an aneurysm, that a statin will help stabilize the aneurysm and prevent breakdown of the collagen in the arterial wall. And I'm not a huge fan of statins. That's one case where I think it can be helpful. And certainly, Crestor, rosuvastatin, low dose at 5 milligrams is what I would choose because it's water soluble and seems to cause less muscle aches than a lot of them. You always need to take CoQ10 if you're taking any kind of statin. So really, I don't care if his cholesterol is a little high. What I would use in that case is to stabilize um, the aneurysm, which is a weakness in the aorta and the endothelial wall. You certainly don't want to have it rupture. That's why you follow it very closely and make sure your blood pressure is normal. Really statins, the reason they may be good in some cases for some people is not because they lower your cholesterol, which they do. It's really because it in some cases it's a pretty good anti-inflammatory for your arterial wall. So in that case, I would agree with taking a low dose of Crestor. Um, so again, I'm not too much worried about a mildly elevated cholesterol. And when we do check lipids, we go deep and get the the particle size, the ApoB, the LP little a. There's a lot of different factors when we look at a lipid analysis, certainly with our Cleveland Heart Panel. So, yeah, I agree.
It's a great question. I love context like that because obviously we talk a lot about statins and don't always talk positively about them. But there's, like you said, there's times where you use statins.
That's why it's good to be if you're a really good integrated medical doctor, you take the best of both worlds, both traditional allopathic and then alternative, more what you would call natural. So you have to have a lot of good common sense about when to use what. So I think that's a good point. You can get too far out on either side and just refuse. I'll never have this. I'll never do that. And so on either side, so you got to have some common sense about it. And you get that through experience and reading a lot, and observing, that kind of thing.
It's a great question. I see Whitney's over there on Instagram, and Whitney, I believe I met your husband today. Super nice fellow. I hope he's there with you. I hope you guys are doing wonderful. I see you, Katie, over there on Instagram. Thank you guys for hanging out tonight and being with us on Tuesdays. This last one here is one we've gotten before. This came in a few days ago over email. Is there anything that can help with tinnitus? And I think I know your answer, but what's your thoughts?
I think it's spelled with two N's, isn't it?
Is it?
I
That's
think
my
it's
fault.
two N's. Tinnitus. I believe it is. That doesn't look right. Ringing in the ears. Gosh, we've tried everything. Pycnogenol. I mean, there's all kinds of herbal things that you can try. I've just never seen anything work very well. I've never seen a supplement or a prescription medicine that helps it much, to be honest with you. Now, if it's associated with hearing loss or dizziness, you may have Meniere's disease, so you can treat that. But just plain ringing in the ears, that's a toughie.
Hmm.
It's really hard. I would like to give you some great, say, hey, yeah, this works, carrot juice works, but nothing I've run into I can put much stock in, to be honest with you. Someday it'll probably go away, but certainly you can use no, hearing aids that have a low level of hum to them that kind of cancel it out. So get your hearing checked and see a good ear doctor and see if they can fit you with anything like a hearing aid that may help that out a little bit. I know Jenny uses a
Hmm.
white noise machine at night because she has it pretty bad. Nothing we've ever tried for her works.
Yeah, that's a tough one, and again, I'm glad this question came up because a lot of people suffer from tinnitus. So thank you for sending that email in. And as we learn more and more, maybe there'll be something that uh, helps it a little bit more.
Hope
We'll
so.
see. Okay, guys, this is my favorite part of the show. We're going to go to the live portion. We're going to answer questions live for you. If you have questions, I see Danielle's question around GLP-1s. That's a great question. I see Lori's. Danny, thank you. Middle Tennessee. We're going to get to hopefully all of them here over the next 40 minutes or so. And let's start with Mama B's Place over on YouTube. I'm taking powder from the powder form of L-glutamine / advanced aminos and magnesium glycinate. Should these be taken all together?
They can be. Yeah, I would. Um, I prefer magnesium, which glycinate is my favorite one. I usually take it at night if I take it separately, which I do. I take a form that has the glycinate, malate, and taurate together, um, or threonate, excuse me. And I take it at night because I think it helps you sleep. It prevents cardiac arrhythmias, which you'll tend to notice more at night, and it also helps your gut. Um, but I certainly don't mind that cocktail. I'd probably take it, you know, more at night. Um, I take a little cocktail with advanced aminos and creatine with HMB in my office every day, midday. So I think that's a good thing. I'm a big believer in creatine.
Yeah.
Just a wonderful, wonderful supplement for all adults because we all lose muscle. But there's a lot of other advantages of creatine from not only muscle and adding a little bit of water to the muscle, which is good because it strengthens them. They hydrate your muscles, but also for brain power. And some people are even experimenting with. I've read several studies of taking uh, 10, 15, even 20 milligrams at night to help you sleep. So a lot of good things, and it will not hurt your kidneys, contrary to popular myth.
Yeah, that is one of the first questions we get around creatine. Is that with kidneys? And we've done a couple episodes on creatine. Are you taking 5 milligrams or 10 a day?
I take 5
Take 5
with HMB, which is that's our formula. I like HMB in it because it's another muscle builder and it's a fat burner. So hydroxymethylbutyrate.
All right, guys, we're going to keep moving. Let's see. There we go. Let's go to Edna. Thank you, Edna. How often can you have PRP? Obviously, the Common Sense MD was with Jill today, and we talked about how often you can get a cortisone shot. I actually think I was behind the scenes with that video of you and Jill, and y'all actually talked about how often you can get PRP. What's your thoughts on this?
Today's episode was more about cortisone, but we did talk about PRP. And PRP is not going to hurt you because you can get it fairly often. Cortisone, you want to limit to 3 to 4 times a year in any one particular joint. But PRP, you could do it monthly if you wanted without problems. I do my knees, and I find that I only need it once or twice a year. Just depends on how bad the inflammation is. But I love PRP, platelet-rich plasma. It's just wonderful. Jill does such a great job of checking it too. And it used to be in the old-timey way you did it. You had the Buffy coat on there, and it really, as soon as you got the shot, you would just need a pain pill almost.
Yeah.
Now it's not painful. You don't get any of the after effect. Don't need to go on crutches like we used to tell people to do. But you don't want to play pickleball for a few days afterwards, just because you want to rest it to get those factors in there, those cofactors, those, and it creates a little inflammation to promote healing. So you could have it. Typically, people, it just depends on how bad it is. Like my knees are, knock on wood, are not that bad, but a couple times a year is all that I need, even maybe once a year for mine.
Yeah.
But some people get it monthly and do fine with it. It's your own blood, so it's not going to hurt you.
Yeah. Thank you, Edna, for that question around
But give it some
PRP.
time. It's not going to be like cortisone. It's not going to, you're not going to feel that much different in a week or two. You need to let it, judge it in about a month or 2 months. Then all of a sudden, my knee's better. But it's from the PRP.
Let's get. I see this right now from Edna. Thank you, Edna. Did knees about 7 months ago. Just now, starting to feel a little pain.
Get back in there and get you another one.
And knees are pretty bad. Okay. Thank you, Edna. Let's go to Foxy Moxie. I saw the question there. There we go. I take a lot of vitamins and yet I'm still getting colds. I do babysit my granddaughter. Seems I get a lot of colds. Help. This makes a lot of sense if you're around young kids.
They carry in a lot of bugs. I'll tell you that much. There's just, but you can. I'll tell you what I would do. I'd take ivermectin. Take ivermectin, 12 milligrams twice a week. It helped tremendously. I had a lady today who does that, and this winter she told me a story where she picked up her son from college at UT, and he was coughing the whole way back in the car. She picked him up the whole way, 2-hour trip. So she takes him straight to urgent care, and he has the flu. And she's thinking, oh man, I've ridden in a car with him coughing all over me for 2 hours with no ventilation. I'm going to get the flu. She never got it because she was taking ivermectin. I like that. I like quercetin, of course, vitamin C, vitamin D, all those. L-lysine's a good one. So being around kids, though, you get sick a lot. So you do a lot of hand washing and things like that too. But ivermectin.
That's interesting.
Right. And I like methylene blue.
Yeah, methylene blue.
I think it's a good preventive as well. There's probably some things you're not doing that could probably help.
If that were me, with that someone coughing in the backseat, I'd be like, "You're going to have to get out. You're going to have to."
Ben gets paranoid. I'll tell you a story about Ben. How he is. He during COVID, he was in Knoxville riding his bike. And he rode on a path past an older man who happened to be coughing a little bit. So he rode his bike past him, and then immediately got off his bike and called me asking if he's going to get it from that. Remember that? I
do. And I'm not particularly proud of that moment.
I don't mean to bring it out through, but it demonstrates that, it's if you're out in the fresh air. It used to kill me to watch people ride down the creeper by themselves during COVID with a mask on their bikes, or riding inside their cars with a mask on. People got so paranoid. You didn't do any of that behavior, but that's really weird behavior. But so yeah, the mask didn't work anyway. Now, if you're sick and you're coughing, it may be appropriate to wear a mask. Let's say you're in a car with the flu riding with a bunch of other people. You could wear a mask and maybe help out a little bit, but you're certainly, if somebody's well and wears a mask, it's not going to help anything.
Let's get to Evangelon's question here for his son. Thank you, Evangelon, for this. Son, age 13, always feels nauseous upon waking every morning and needs to vomit. Possible causes are a pet rabbit, including grass bed and cedarwood chips, perhaps ADHD. Any thoughts around this, Doc?
So does he have ADHD, or you think ADHD is causing the nausea? I'll tell you one thing. if it only happens Monday through Friday, it means he doesn't want to go to school. that's that's something I see in teenage kids a lot. They have all these gut problems, and you work them up to the hilt, then you find out, it's more stress related. Now he may have GERD. I'm not saying it is stress related, but I do see that in a lot of kids, that gut brain connection. So I wonder if he's eating something at night. I wonder, the other thing I'll probably check a blood sugar on him. Pop a continuous glucose monitor on him that you can get over the counter now called a Stello. I love them. And just monitor sugar levels and see what that's going on with that. Look at his diet pretty closely. Bowel habits, that type of thing. Stomach cramps, stomach pain. And it could be something he's eating. I sure want to rule out high elevated sugar levels though. ADHD, I don't know. But try to take note of when it occurs. If it's a Monday through Friday, but he's fine on the weekends, you start suspecting he doesn't want to go to school. He has some stress at school.
Yeah.
Always ask your kids what's going on. If they're upset or they start getting sick much, or ask them about what's going on at school and see if they'll tell you.
That's a great point. That's a great point. Thank you, Evangeline, for that question. Foxy Moxie's got a follow-up twice a week with the ivermectin for how long? Is this kind of indefinitely if you're around your grandkids quite a bit?
Yeah. Uh-huh. Yeah.
All right. Let's keep moving, guys. Thank you all for all these wonderful questions. If you have a question for Doc, put it in the comments. I'm going to do my best here. Let's see here. Real quick.
No, it's the lighting in here. No, I'm not sunburned. It's the light in here.
I love it. Thank you, Barbara. I needed that, Barbara. That was good. That was good. I needed that. Okay, let's get to Jerry here. What's your thoughts on nicotine patches for the spike protein? Also, can it help breast cancer? I found too that spermidine helps cancer.
Spermidine.
Spermidine.
Yeah, I've read both of those for cancer. It's not in my protocol because I don't see enough research on that yet. But certainly for nicotine patches, we treat a lot of long COVID with nicotine patches, and it's very helpful. Nicotine is actually not a bad thing. It gives you energy, helps your brain think better. It's really good for dementia. It's good for that brain fog that people get from long COVID. It's good for adding it if you think the spike protein from the vaccine or getting COVID has damaged you. Nicotine is very habit forming, but the patch is a slow delivery patch and actually has brought taste and smell back to a lot of my patients. I've just read more studies about it used for the brain than I have for cancer. Same thing for spermidine. I just don't know if it helps cancer much, but I'm not saying it doesn't. I just don't have the information and the research that it does. But certainly, nicotine patches are not just for quitting smoking. It's really kind of a good supplement for a lot of things, especially long COVID, spike protein, that type of thing. We use it a lot during COVID.
Jerry, this is a great question. Thank you for putting that in. I see Hunt Mommy on Instagram got pellets yesterday. Thank you so much. It's amazing. Let us know how you're feeling. Let's go to, this is a testosterone question from Candy. Thank you, Candy. Will you please go over what you like levels to be on your testosterone and estrogen? I know Andy likes it higher than the recommended average. Thanks. What's your thoughts on this?
The recommended average doesn't mean anything on the lab sheets. So just don't go by that. What I look at is the ratios of estrogen to progesterone. And then with testosterone, I think the recommended or normal dose on Quest Lab that we do are something like anywhere from 10 to 40, 45. We think most women feel better at about 100, 80, 100, some like 150 if they work out a lot. You need labs, but we go more by clinical picture than we do laboratory. Estrogen, progesterone, generally we like to see your estrogen about 60 to 80. Some people like it higher. We go by symptoms also. Progesterone, 1 to 2, about an 8-to-1 ratio of estrogen to progesterone. So, but clinically is the most important thing. Or if you start getting too much, when you're getting too much testosterone, if you get hair growth or acne, you're getting too much estrogen if you have breast tenderness, spotting, abnormal bleeding, too much progesterone if you're tired all the time or gaining weight. So, and again, remember, if the blood tests don't correlate with your symptoms and you're on a cream, then get salivary tests just to double check that and see.
That's a great point. And Candy, if you haven't watched the Explain This episode with Robin Riddle on low testosterone in women, she goes over some of the levels and why. If that's of interest to you, but great question. Because a lot of what we say is not what the average says. So thank you for asking that and letting us clarify.
The woman I saw today, her testosterone that made her feel so good mentally and physically, especially mentally with cognition. Her level initially was, I think, 7 to 10. And her on just 1 milligram of testosterone cream, it came to 44, and she felt great just at 44. So
interesting. Yeah, that's super interesting.
So
great question, Candy. Okay, let's get to Danielle. Thoughts on the recent announcement of compound pharmacies no longer being able to offer GLP-1s? Thank you for the question, Danielle. It's super timely. Doc, kind of walk us through, what we've kind of talked about internally and stuff like that.
Yeah, they were used by compounding pharmacists quite extensively because there was a shortage, and they were allowed to use it during shortages. So compounding pharmacies cannot make a medicine that's available through a branded company if it's exactly like it. So they have to make it a little different. And with the GLP-1s, there's a lot of stuff going on with them right now because they are very expensive. And unless you are morbidly obese or a diabetic, they're hard to get coverage from pharmacies, from your insurance companies. So that's been a real battle when these things are so good for so many people. So what you have to do is use it for another reason. And we've been able to do that so far. I hope it continues. You just need to make sure you're getting it from a trusted U.S. source. So you have to have a good reason, an off-label reason. So you can't use the compounded ones for diabetes or weight loss. We found them to be very helpful for PCOS. We've found them to be very helpful for inflammation. It seems to help arthritis. It helps migraine headaches. It's really used as a longevity drug. And one thing about it is a lot of times we're using microdoses. Some people can't tolerate even the lowest dose of a GLP-1. So we'll use microdoses of it. And the only way to do that is through a vial of a compounded GLP-1 or GIP. So in other words, like for longevity purposes, I use as little as a 0.75 milligrams of tirzepatide. It works well. The other issue we've had with the branded names is that these medicines are maintenance medicines. They're not, I'm going to lose 30 pounds and get off of this. If you get off of it, you're going to gain the weight back at least 95% of the time, if not 99%. So what I like to do is work the dose up until you get your weight where you want it, and you've learned how to eat, how to exercise, how to modify your diet. Then I'll work it down to a microdose. that you take way less than the lowest dose on the branded pens and stay on it, because the side effects are way less heart attacks, less strokes, less dementia, less inflammation, just a whole host of things that they're finding out about these things. 1 in 10 Americans is on a GLP right now. 1 in 10 adult Americans. And that's probably a conservative estimate.
That's wild.
It's crazy. And I predict it'll be way more than that soon. And it's people think, well, I just ought to be able to do it on my own. Well, some people can't do it on their own. I'm convinced of that. It's not just eat less and exercise more. That doesn't work. It's insulin resistance, and it's controlled by a gut hormone, 2 of them, really 3 of them. There's a new one on the block, but certainly the GLP-1s and the GIPs. And I found the combination to be a little bit more effective with less side effects. So that's kind of the stay tuned.
Yeah.
Because the FDA tends to want to shut down things like peptides that actually work.
And it's a great question, Danielle, and thank you for letting us talk about it, get a little behind the scenes of the way we're looking at it. I hope that helps a little bit. Guys, does that help around the GLP-1s? Let me know in the comments. Okay, we're going to keep moving here. I saw a great question from Lori, and I see we got Steve in here. My brother is in here from Shield Nutraceuticals, who also, excuse me, was helping out. I'd be interested in what Doc says. Can you take Digest Shield at the same time as berberine before meals?
Hey, Lori. Yes, you certainly can. You certainly can. As a matter of fact, there's a very few people that get a little stomach upset with berberine. So I think it's a great idea. Great idea. I love Digest Shield. It's by far the best gut pill out there.
So Steve is saying take Digest Shield before the first bite. Just started the dihydroberberine, so we'll be interested to hear. Oh, cool. That's super cool, Steve. Thank you for putting that in there. I hope that helps a little bit, Lori. Let's keep moving. Danny on YouTube. Thank you, Danny. What's the difference between the statin and the new statin, Repatha?
Yeah, Repatha is not a statin. It works by an entirely different mechanism. And it's an injectable. I don't use it because I'm not in a clinic that does insurance, so I'm not as familiar with it. But occasionally I'll send somebody to the lipid clinic through cardiology to get it started. But Repatha it really, and I forget the route, how it works. It works in a little different. It doesn't really turn off that enzyme in your liver like a statin does. So you don't see the side effects that you do with the statins. And it's very powerful. You're going to get halving of your cholesterol with that. So I have some patients that have gone and done it, and they just haven't had, side effects like muscle aches and all that you get with statins sometimes. So it's 2 different medicines. I hope that they're going to come up with a pill very soon, if it's not already there, that can provide that same lowering. But again, I'm not huge on lowering your cholesterol that much, unless it's just familial hypercholesterolemia and you have a lot of other risk factors. But it seems to be a real potent drug if you want to just lower your cholesterol level.
All right, Danny, I hope that helps a little bit. Thank you for that question. Let's get to Middle Tennessee. Urologist has me on meloxicam and doxycycline. Do you think peptide treatment would help instead of antibiotics? Real quick for context, the urologist laughed when I told him I was taking a saw palmetto supplement. What's your thoughts on this, Doc?
I don't know what you're taking it for. Is it prostatitis?
See if I can find any
what's the
context.
That's what I would guess. He has you on that, or epididymitis maybe. Certainly if it's prostatitis, we're not even sure if it's bacterial. We're not even sure if prostatitis is mainly bacterial. To really find out, you have to get a sample, which is a very uncomfortable little procedure, and they look at it on the microscope, then they could culture it out, but it's probably mostly inflammation that causes prostatitis if that's what you're on that for. And certainly, if you do get on antibiotics, it's going to take a month's worth of antibiotics to make a dent in it, maybe very longer. Prostatitis is hard to treat.
Mm.
I always add methylene blue in there. So it's a tough gig. I had prostatitis one time. It's uncomfortable.
Mm.
And certainly the meloxicam, which is Mobic, could provide some comfort to you because it's just a good, safe anti-inflammatory. Doxycycline has a lot of gut issues, so if you're taking that, you better take your Digest Shield. But it's just depends on what they're using it for. And you probably laughed at saw palmetto because it's just a mild herb that may help you with prostatic enlargement, but it's not going to really help prostatitis if that's what you have. It won't hurt it either, but it's just not a real potent thing. That's probably why he laughed. But there's other herbs that you can take, which I believe do help some. I had a patient today that told me they thought this is not helping. Saw palmetto in combination with stinging nettle, pumpkin seed, which is typical in these prostate formulas. So he stopped it, and he definitely realized it was helping him some. That's not going to be as potent as some other prescription medicines like Flomax, finasteride, or that type of thing. Yeah, a low dose of finasteride is what helped me more than anything for prostatitis when I had it, no doubt.
Super
And
interesting.
low dose finasteride is really good for keeping your hair on your head too.
Yeah.
It shrinks your prostate and keeps hair on your head. You don't want to take the full dose for hair that you take for prostate because it has a lot of other unwanted sexual side effects. So they usually recommend about 1 milligram. Men or women of non-childbearing age can take finasteride. It's a DHT blocker, dihydrotestosterone blocker, which causes two things: hair loss and prostate enlargement. So it can be a good drug in combination with minoxidil, low dose, and the hair vitamin. That's what Annie and I take. I don't know are you taking a hair vitamin, Ben? Your hair's pretty good.
No, not yet. Not yet. But Middle Tennessee has such a great question. Thank you for that. Thank you. I love this from Roel. Doctor, how often should we clean our ears? I've heard different things around this. I've heard using a Q-tip's not that great.
Yeah. I had a patient today that asked me, should I use a Q-tip? I go, no.
Yeah.
And I looked in their ears because there was no wax in the ears. She had eustachian tube dysfunction. I told her to use a Navage and Flonase. But don't stick anything smaller than your elbow in your ears. That's what my mom told me. Try to get your elbow in your ear. Can you do that, Ben?
No.
Try to fit. Man, that's hard. You gotta be flexible.
I gotta show Tom. Can't do it without showing Tom the guns.
You've been working out.
Working out a little bit.
You're taking creatine because you got a little pump going on. So a lot of people do ear candling. There's some solutions you can put in your ear to help drain it. It's how you clean them out. Sometimes we have to irrigate them. You can get a home kit to irrigate your ears. We've got a few nurses in our office and medical assistants that love to clean wax out of ears.
Yeah.
So just if you're unsure about it, let somebody that knows what they're doing do it. And just don't stick a Q-tip in your ear.
How often would you?
It's normal to have wax in your ears. There's a purpose for it.
How often would you have to get your ears cleaned at like a medical office? Like, is that just once a year, once a blue moon?
No, it just depends. Most people never have to have it, but some people perform excess wax, and once every 6 months they come in, and it's hard wax that we have to clean out. Sometimes I have to pick it out. Some of the ENT guys have a special suction instrument that's even better. So just be careful about sticking anything down in your ear. I'm not against ear candling. I've done that before. It seems to be pretty effective.
Thank you, Roel. Let's get to Jack, and I'll get to Jerry. See a question from Steve there. One of my guitar students is getting an insulin pump this week. He has 2 private 1-hour lessons with me every week. Is there anything I should be aware of? This is such a thoughtful question.
Great question. I'm glad you're tuned into that.
Yeah.
You know, as a guy who has 2 type 1 diabetic kids, you know, on the insulin pumps, you know, it's very important. Yeah. I mean, you should always have something around in case they get low.
Yeah.
But they're probably pretty familiar with how they feel. As type 1 diabetics are like little doctors in themselves. They have to know what to do and how they feel. They have a continuous glucose monitor that will tell them. Just have something around that they could eat, like a glucose tablet or some candy or something like that if they get low. They're not going to get too high on you in that time, but they could bottom out and get low. Gosh, I don't know if it's Andy or Kelly that one night when they were young went from 550 to 25 within an hour without doing anything different.
Mm.
So they can be quite brittle. But just be aware if they're getting kind of out of it, sweaty, if they're slowed speech, if they're about to pass out, you better ask them, what's your sugar? Get some candy. Because you can't overdo it. I mean, if they're high and you give them sugar, it's not going to hurt them. If they're low, they need it. So some people even, you know, will take a glucose pen. And usually type 1s travel with it. So if you're really worried about it and they're very brittle, and they've gone out before and had to have that glucagon, then you ask them, do you have a pen with you? Do you have some glucose tablets? If you went out on me, where's your pen? How do I use it? That type of thing. I don't think it'll happen. But I know one time playing guitar myself, when I was playing Inagata Devita, which is a very long song, I played it so long that I got hypoglycemic.
No.
No, I'm just kidding. I can't play that song.
Jack, such a thoughtful question. Thank you for being aware of that. So if you have any questions around this is the place to ask it.
Jack, I was playing with Tommy Emmanuel one day, and we were practicing for hours, and I got hypo. Yeah, because Tommy's really good and fast, and I didn't eat. I'm kidding.
If you're getting ready to play with Tommy, you gotta.
Although I have eaten dinner with Tommy one night in Knoxville many years ago.
That's right.
He's the best guitar player in the world, best acoustic guitar player in the world without doubt. Heard him many times. And I'm sure you know who he is.
Tommy Emmanuel. I saw him in Indiana. Let's get to Steve here. My wife and I just started taking dihydroberberine to manage our LDL cholesterol. What doses do you recommend, and should we add garlic? We take fish oil already. Great question, Steve.
I'll do it. I think garlic's great. 200 milligram twice a day. Can start at once a day, then go to twice a day if you need. You're on omega-3s. I like aged garlic. Another one you could do if you're interested in herbs, obviously, is hawthorn. Is a pretty good one. So those are really good. And don't freak out about your LDL as much as a lot of people do.
Thank you, Steve, for that. I hope that helps. Let's get to Dave here. Thank you, Dave. Is there any treatment for extreme gangrene in a foot where surgery isn't an option? Bad heart, 90 years old. Chelation therapy, DMSO, Manuka honey. So it's around extreme gangrene in a foot.
Wow. That's Dave, we got another guitar player.
Yep.
And we got a lot of guitar players here tonight.
Yeah, we do.
Gosh. Gangrene in the foot is a serious thing. It can kill you because you can become septic from it. Bad heart, 90 years old. I mean, he's more likely to die of sepsis from gangrene than he is from getting surgery. They can even do local surgery at times with blocks like a spinal. I just don't know if DMSO is like a wonder drug if you can get it and get it in the right dose. I don't think Manuka honey is going to be potent enough. Chelation, probably no, because you'd have to get months of that daily IVs So I just wonder if it's a diabetic toe or what kind of situation it is. But if it's gangrene, it's going gangbusters, then it's a tough gig, and the best option is to get rid of it if
Mm.
you can. Some people use hyperbaric oxygen. If I think DMSO is a potential treatment for it if you can get the right stuff, and if you can use it even locally, it may work. That's a tough gig. The
Mm.
first time I ever saw surgery was gangrene in the leg.
You told us
Was it?
about this weekend.
Did I? Yeah, have I
Yeah.
told that story on here before?
No, no.
I was in the 10th grade, and my dad, who was a surgeon, woke me up at midnight on a Friday night and asked me if I wanted to go do surgery with him. And of course, yes, I want to go see surgery. So he said, "You may want to be a doctor someday. So come up and we'll operate tonight." And that was back in the days when, I guess this was late 60s, when you could take your son up there and be in there in the OR. Nowadays, you could never do that. But in any event, so we went up there, and this guy had bad gangrene on his leg, mid part of his leg, creeping up fast. It was a particular form of gas gangrene, so it moved fast. So we were amputating his leg. So, and we scrubbed up and everything. I always thought I was the coolest thing ever, scrubbing and getting all the gloves, the wrappings, and I scrubbed in with him. And he cut down to the bone, separated everything, tied off all the nerves and vessels, then handed me a saw. And he goes, "Saw this man's leg in two." So I did. And so, so the leg, I sawed the bone in two. And he said, hand the leg to the orderly over there in the corner. So I took the leg over and I handed it to the orderly, and he turned it, he went down and incinerated it or whatever. Then we closed it back up and created the stump. But that was my first experience in medicine. So I would say if it's that bad, think about getting it off. 90 years old, heart disease, do a local. It's
Mm.
amazing what you can do nowadays. But don't wait around. I just don't know if
Yeah.
the other stuff's going to work, Dave.
Dave, thank you for that. It's a great question, and that came up this weekend, Pop. That's
That
such a cool
story,
story.
that,
Yeah,
that
such a
was a
cool
good
story.
story.
Okay, let's keep moving. We're gonna get to as many as we can in the last 8 minutes or so. Let's see where I'm at. Thank you guys for being with me, D-Lan. Ben, are you in the medical profession? Also, no, but I am on the business side of it. But I'm not a medical professional. I'm learning what you guys are learning. I'm very interested in my own health, and that's why I get so much out of your comments and questions. And I love learning from Doc as well.
Ben's kind of like Joe Rogan. He's a good interviewer. He's very interested in things.
I'm very
And
interested, but to answer D-Lan's question, I'm not a medical professional. Okay, let's keep moving. Let's see where we are at. Let's get to Wayne here. Thank you, Wayne, for being patient with me. Epitalon, is it worth it, and how much and how often do you administer? And if I'm pronouncing that wrong, I apologize.
I've never used it. So I've never used that. So I'm hesitant to say, but I'll do my research on that. Write that down, Ben, and we'll try to come up with a better answer for you next week.
And Wayne, I'm gonna write that down. We'll do a little more research on that. Let's go. I see Kelsey's in here. Kelsey, so good to see you. Lisa, what's up? Great to see you. Let's see. I saw Jerry had a question real quick. We can answer this one. Can you take ivermectin, fenbendazole, and doxycycline together?
Yeah, you can. You can. I use a lot of ivermectin and fenbendazole for cancer patients. I usually use them when I use it, I usually use one of them 2 days a week, the other one 3 days a week. I kind of alternate them. They're both anti-parasitic, but they're both very, very good for a lot of different purposes. And doxycycline, of course, is not going to interfere with it. I just tell people not to take the antibiotic right around when they take any probiotic. and maybe separate it from when you do take the timing wise, 6 to 8 hours after you take the other antiparasitics.
All right, Jerry, I hope that helps a little bit. Let's get to Diane. Greetings. Have you got a protocol for a parasite cleanse? And your thoughts on ivermectin?
Yeah. We do have some protocols for a parasite cleanse. They're usually, God, what's the name of the one that Andy
Cellcore.
does? We do it through Cellcore. And he did a 4-month detox, parasite cleanse, and past worms, as everybody's going to do. But I love ivermectin. How the protocol for parasite cleanse, if you're having problems, is different than if you just want to do it. If you just want to do it thinking you probably have parasites, which we probably all do, just ivermectin. I love ivermectin. I take it twice a week anyway. I don't take it year round twice a week, but certainly at times. I love it. It's a great probable cancer preventer. It's a great for infections. I love ivermectin. We use it out the wazoo for COVID, and it worked.
And Diane, we have a if you look up parasite performance medicine, a couple videos will show up talking about the different protocols based on what your goals are. So hopefully that helps a little bit. All right, let's keep moving here. Let's get to Karen, and I see Steve's got a question too. Question on AFib: no heart problem or family history. Question, after heart monitor test completed, are meds, Eliquis, and beta blocker necessary? Any risk if I still want to work out when being advised not to? Do I need a quick visit with you? I appreciate all your advice. Thank you so much for being here, Karen.
Yeah, if you've got AFib, well, my good friends came out with AFib last week, and I referred him to a cardiologist, Dr. Dan O'Rourke, who had a great visit with him, who took the time to explain it. AFib is a common arrhythmia, and the reason it's can be dangerous is because the top part of your heart is fibrillating. It's just quivering. It's not as efficient, so you may develop shortness of breath. But the main problem is you could form a blood clot in the top part of your heart that could lead to a stroke, and that's why you take a medicine like Eliquis and a beta blocker. Usually this depends on what your rate is. Usually I prefer a calcium channel blocker more, but you definitely need an echo, and that's why you should definitely let me know, and we'll work you in for that, because that's something you don't want to fool around with. It's odd that sometimes it's just picked up incidentally. I see it a lot in people that have been distance runners or bikers and endurance athletes for some reason. And if you're an AFib with a high heart rate, I wouldn't work out too unless you get out of that rhythm. You don't want to overtax your heart, because your rhythm can get kind of high with AFib. And that's why you're taking preferably a calcium channel blocker. But there's ways to convert it. You can be cardioverted as well. And that's probably what would happen if you didn't convert medically. Sometimes they can convert you with an IV of a calcium channel blocker. Other times it's a little mini shock to get you back in rhythm. So if you have AFib, yes, you need to see somebody who knows what they're doing. So don't work out, get seen. We can get you taken care
of. Thank you, Karen. I hope that helps a little bit.
Tomorrow, if you need.
Yeah, for sure. Thank you, Karen. Steve is asking, my wife started losing her voice a few weeks ago and has gotten worse. She went to the ENT doc and he said it was silent GERD. She was prescribed esomeprazole, and after several weeks, her voice is still weak. Any suggestions?
It may not be GERD. Obviously, he probably looked at her vocal cords to make sure she didn't have polyps or any kind of vocal cord paralysis. I'm surprised she's losing her voice, because she doesn't talk that much when she's around you, because it's hard to get a word edgewise, isn't it, when you're talking with Steve?
Come on.
I was trying to make a joke and nobody laughs anymore. But in any event, so it could be a silent GERD. That's always the thing we kind of blame it on. If that's the case, you probably should do an EGD through a GI doc and see if she has irritation in the esophagus or Barrett's esophagus. I'd rather do that to just look and see. Otherwise, you're guessing, and you don't want to commit her to taking PPIs the rest of her life. I mean, God put acid in your stomach for a reason, to digest your food. I guess you could take Digest Shield, which I'm sure she is, but you still want some natural acid in your stomach. And of course, Digest Shield does not reduce acid. You don't want it to. So if it didn't help after several weeks, I wouldn't take it. I would see a GI doctor, get the esophagus looked at, and see what else may be going on with that. It could be one of several things. She may need some more studies by the ENT doc as well. Sometimes I've found that a thyroid can press on your neck and give you a little hoarse voice. But losing her voice, most of the time when I see that, it's just pure strain. But obviously, it sounds like if she had strained her voice and was resting her voice, it would be getting better by now. So pursue the GI esophageal route. And if that's normal, go back to the ENT. So this is not working, and maybe pursue a little further workup on it. It's probably not going to be anything bad, but still, there's a reason for something. I don't know if it could be allergies, if it could be sinus drains, if she's taken anything different. Always, if you have a weird symptom, always look and say, have I added anything, any prescription medicines or any supplements that could be causing a weird reaction? Because it can happen with anything.
Yeah.
And you can take it all your life, and one day, boom, you can't tolerate it.
I'm going to put this up here because it's great. Steve's not laughing, but Sheridan did laugh.
Well, Sheridan, that's because Sheridan's got a way better sense of humor than Steve does. Steve's too serious sometimes. You notice that, Ben?
I love Sheridan's sense of humor right there. I love it. Thank you, Steve.
He's always smiling, though. He may not laugh as much as Sheridan does, but
Steve is the absolute best. Steve is he's such a light in my week. Such a light in my week. Our time together every week, man, is just so much fun. I get so much out of it, man. Thank you so much for being you. I want to get to Sandy here because I've missed her. Where if I can find Sandy, saw a question. Did you ever find out the Unicity is a safe product for insulin resistance? Have we looked into Unicity?
You never reminded me to do that if you're supposed to. Put that on the list.
Okay, so
I'll have to check that out.
So I got Unicity.
I've got two things I've got to look up for next week.
I got Epitalon and Unicity. Okay, Karen, I'm going to get to that.
We'll get to both those next week.
And real quick, I don't know if we can help Sandy with this one or not. Eliquis had a negative effect on my beloved dad. He has long passed, but it caused him to lose 32 pounds and cause seizure. So that may be rare. Shoot.
Eliquis can be a harsh drug.
Yeah.
It really can.
Sandy, thank you for putting that in there. I'm sorry about that. Okay. I think we'll end with this. I saw Katie's answer. How is Dr. Rogers doing with the new EMR? What's your status update? How are you?
Well, yesterday was the toughest day in my practice, I think, that I've had, just because of trying to get used to doing it. And when I'm in a room with a patient, I like to focus entirely on the patient. I don't like to have a computer even in there with me. So I'm having to do my notes in a little different way. Although it is better because I can dictate through the EMR and certainly medicine list and know what's going on. It's just better. But yeah, today was way better. So yeah. I'm getting there. I have plenty of help from Katie, and Ashton really helped me a lot today. So, and you're right. Rachel Jackson is amazing.
Excuse me. I will say, I think you're doing awesome with it, and you've got amazing help. Katie's been just right there by your side through it all, and Ashton today. Thank you guys for being so helpful during this transition. We've had just the best team. I see April's in here as well. We're all working together on this, and Rachel, of course. I saw Ivy in here. Kelsey's in here from Bristol. Everybody's working as hard as they can on it, and we're all helping each other out. Pratik's amazing with it. So
These young people are way better. I mean, all the youngsters are great with this kind of thing. It's just amazing to watch them work on computers.
Yeah.
When you're as old as I am, you're just not going to be as good on computers. So you have to ask for a lot of help, which I get. I mean, I get so much tremendous help from everybody. I mean, yesterday Kay was holding my hand the whole time and leading me right through it. It was really, really good. So.
And these first couple of days have just been amazing. Like, again, Katie gave a great shout out to the team. The team has just done amazing with this transition. And I'm going to put this up this is great feedback from Patty. Thank you, Patty. Staff was grooving with EMR, and Doc came in with laptop. I had some cheat sheets. He still looked at me when he spoke. That's awesome. Yeah.
And I always will.
I
appreciate you saying that, Patty, because it was tough for me to even bring a computer in. Today, I did not bring the computer even in the room with me. But at some point, I'll have it over on the side to send in instantaneous prescriptions and things like that. And I'll have a much better access when I look at what's your labs from there, instead of looking back at, through the paper charts, because we have a lot of patients.
Yeah.
When I first started this and went just to paper charts, I didn't have 12,000 patients in 6 offices.
Yeah.
So it's mandatory that we have to do this. But sometimes you have to do what you have to do. We're doing it. And thanks to my staff.
Yeah.
It's just amazing. We got all these smart people. I'm not that smart, but I'm smart enough to know to work with smart people.
Yeah.
And they're way smarter than me. So that's my secret sauce is getting people to work with you that are smarter than you are. So that's definitely been the case with me.
Yeah, the team has just been amazing, and I can't say enough. I can't say enough about what this last week and a half, and for Katie, Andy, Ben, Carter, April, the whole team has been working on this for the last 3 to 4 months, getting ready for yesterday. So I'm just so proud of everybody, and we're pumped to be a part of this transition, and I'm looking forward to how it's going to benefit the patient, like you said. So thank you guys so much. So many of our team is in here, so thank you guys. Y'all are the best. How we do? Let us know. Let us know in the comments. I see. Thank you, Roel gives us a 10. Thank you, Karen. Thank you, D-Lan. We love doing this. Esty Bestie, I see you. I got to hang out with you last week. Man, that was so much fun. Thank you so much. Thank you to everybody over there. I see Celeste is in there as well. Celeste, I love you. Let us know how you did. Jerry gave us a 10. Thank you, Tom, a 10. Doc, I love you, man. You need to go take a walk, get on the bike ride. Hopefully the weather over there is okay.
Be safe. Love you, Ben. Good night, everybody.
Good night, everybody. Thank you, Sandy. We will see you next week, Tuesday, 7 to 8. We do this every single week. Please come back. We do this for you guys. We love you guys. Poppin', I love you. I'll see you here in a bit.
You too, Ben. Good night.
Where's my outro?
Don't go away.